Welcome back. We have our Medicare and health insurance experts with us today. Catherine Sevier from AARP, Steve Edmonds from Alliance Insurance Services. All right, Catherine, let's talk about Medicare and let's talk about travel, whether Medicare covers you when you're traveling just stateside and whether it covers you if you're going international.
Yeah, so Medicare covers you when you are stateside. You can go to any provider. If you are out of your own area, you can go to a hospital that covers, that takes Medicare payment and get care. What you can't do is travel internationally and go to a hospital there and expect Medicare to pay for it. You need to think about purchasing travel insurance if you're going to leave the country.
Okay. And that is with a lot of regular health insurance anyway, not just Medicare. Steve, this person says, if you need to apply for Medicaid, can you still keep your Medicare Advantage plan, or do you have to have regular Medicare?
No, you can still keep your Medicare Advantage plan. However, if you apply for Medicaid and you're accepted for Medicaid, we have Medicare Advantage plans that are tailored to coincide with Medicare and Medicaid people. So it gives you much richer coverage, lower co-payments, less out-of-pocket expense. So if you're accepted for Medicaid, you still need to check with your insurance professional because there will probably be a better insurance plan for you.
Okay. Catherine, this person says, I can't retire until I'm 67. Can I get Medicare at 65?
You can get Medicare at 65, and you should apply even if you are going to continue working for the reasons we've talked about before. There is a penalty if you don't.
Mm-hmm. Steve, this person says, I'm on Social Security disability. I'm 62 right now. When I turn 65, will my Social Security automatically roll over and will my money increase?
Your Social Security and your Medicare will automatically roll over. We kind of talked about this on a previous question.
Gotcha.
When you turn 65, you will get an opportunity to sign up for a much richer Medicare type plan called Medicare Supplement or Medigap coverage. And you should investigate that because sometimes that can be more advantageous than a Medicare Advantage. Not all the time, but sometimes it can. So even though that it does roll over, I would still investigate the insurance end of it because you might be able to get better coverage.
Okay. And Catherine, this person says, I'm 66 and I'm paying my Medicare premiums every month. So why am I still having Medicare taken out of my paycheck?
Everybody pays Medicare regardless of how old you are if you are earning money and paying taxes on it. The Medicare that you are paying likely goes to your Part A coverage, and it just becomes part of that big pool that we all know and love that is the Medicare payment pool that we pay into.
Mm-hmm. This person says, when my father signed up for Medicare, he did not need drug coverage. That's that Part D. Later, when he did need drug coverage, he had to pay a penalty fee. How do you avoid this fee? Now it's too late.
It's too late, yeah. So the penalty is going to be 1% per month for every month that he went without prescription drug coverage. So 5 years, that's 60% increase. No way to avoid it. The only way to avoid that is to sign up for prescription drug coverage when you turn 65 and when you enroll in Medicare. You want to do it right away, right off the bat.
Mm-hmm. This person's asking, I'm drawing disability. Do I need to do anything different at age 65?
Well, I think we've talked about that a few minutes ago, but yes, you do want to at least check in with Social Security and Medicare and just make sure everything's in line. And if you have an insurance agent, as Steve has said many times before, we really want you to review your policies. And that's a very smart thing to do periodically, regardless of where you are in this whole Medicare process, is to ask the question, does this fit for what my needs are at this point? And every year there is an opportunity to look at that, review it, and make changes.
All right, and speaking of every year, there's going to be changes next year for the drug prescription policy. So we're going to talk about that in the next segment.